After your post-op appointment or as you're further along in recovery, you may be ready to start bearing weight on your foot and your ankle. What does that mean? It means you're not fully walking on your ankle like I am, where I have both feet on my ground, even distribution, and when I walk, all my weight is going onto my foot. We want to make sure that we're just gradually starting to add weight onto your ankle. We're not starting all the way full weight, because that might cause some irritation, might be uncomfortable for you. So kind of the technique that we do, that we show people how to start partial weight bearing, is we're going to take our crutches, and our crutches are going to move forward, and then we're going to take our bad ankle / foot, and that's going to kind of come through. And when we're walking through, we're making sure that we're putting a little bit of weight on our hands and a little bit of weight on your foot. Sometimes we might offer it just to start off with it touching the ground first, and then you start to further add a little bit more weight over the course of the next few days. Typically, it might hurt a little bit, might cause some increased pain, discomfort. That's just kind of just some onset muscle soreness, things you're just starting to get used to. They might get a little irritated. You can dial it back if it starts to get a little bit too painful. When I say dial it back, a little less weight. So what we're going to do is we're going to show them again. Crutches come forward. We're putting our weight on our hands, a little bit on our foot, and then we're stepping through with our good foot. So we're going to do it again, just like that. And the first couple times when you do it, it may look a little rough. It's just like learning to ride a bike. Once you get better at it, you'll be able to really start to walk around, do more. What we want to make sure is that when you're practicing this, you're doing it at home or somewhere safe where you know that there's not going to be any external factors that might cause you to trip and fall, slip, or anything like that. It's very important during the winter time. We do live in Maine. We do get a lot of ice, to make sure that we're being very careful, paying attention to ice. And this starts to allow you to be a little bit more stable, a little bit more careful, but we're always making sure that the bottom of our crutches, if we were to lift up our crutches, they're nice and clean. There's not a lot of salt on there. There could get a lot of salt, so we want to make sure that they're nice and clean and they're not wet. Again, we're just always being safe. You're making sure that you're not swinging from these. You're just being nice and controlled. Everything's very deliberate in what you do. We want to make sure that you're being as safe as possible for yourself.